Okay, thank you for the introduction, Michael. And thank you for all the previous speakers. I probably can finish this talk in 3 or 4 minutes. I don't have anything to say really. That's perfect. I'm a little bit short anyway. So this is a project that's been ongoing for about 2.5 years, and we're trying to do acoustic microscopy to basically analyze lymph node data at lower frequency, but still high frequency. And you might have seen me talk about that 26 megahertz study. It's a different grant. It's been ongoing for 9 years already. And it's looking at finding cancer in lymph nodes. So typically, during surgery, they remove the primary tumor. They take some lymph nodes that are near the tumor that are the most likely to contain cancer. In the case that they contain cancer, it clearly changes the treatment and the care for these patients. So it's very important to find out whether they contain metastatic regions. But there are some limitations from the pathology side. So they typically excise up to 20 lymph nodes, and they just basically look 1 or 2 or 3 sections. They don't have time to look at the entire lymph node for all the nodes, and so they can miss multi-metastasis. And here is an illustrative histology images where you will have 2 cancerous regions, and if you were to look in the middle, you would miss the cancer. So that project, again, is not really the project I'm talking about, but it's connected to it, was to find, to use quantitative ultrasound technique at high frequency to at least guide the pathologist toward suspicious region for cancer. Okay, and so this is the way we scan the lymph node using a single element transducer, and that's kind of a typical final image associated to this histology image. And here it's a very simple readout where the red signify cancer and the green signify no cancer, and it's based on QS, quantitative ultrasound analysis. And here is the idea that now we would tell the pathologist to cut this way compared to this way, which I had on the previous slide. But the way we do that is we use a model-based approach, and we specifically use a Gaussian form factor to fit to the backscatter coefficient that we estimate from these lymph nodes. And actually, we do have very good results on colorectal lymph node, and we have also good results on breast nodes, but we're trying to do better. And the idea would be, instead of using some kind of a naive universal form factor, could we get form factor from experimental data? And of course, we're thinking we can do that from acoustic impedance. And the idea is that maybe with this more tissue-specific form factor, we could improve specificity and sensitivity. And of course, at the moment, there's very limited data to do that, but we're thinking that acoustic microscopy can provide it. So I don't think I need to introduce much more about acoustic microscopy, but we're using very high frequency ultrasound. It's actually very well established for soft tissue. You're getting the resolution in the order of sub 10 microns. There's very little data for lymph node. And so the objectives of this project were to, on the basic side, get acoustical property of cancerous human lymph nodes using the 250 megahertz acoustic microscopy system, and also, which I'm going to be focusing a bit more, see if we can deduce scattering form factors from that data. So you may or may not have seen this slide, and you may have seen it once, or you may have seen it twice, but this, I'm going to go through a little bit quickly, but actually the acoustic microscopy system is not so complicated in the conceptual way. We are raster scanning a transducer on a sample that has been fixed on the slide. We're pulsing a transducer, and we're receiving the signal through a preamplifier and an oscilloscope that has very high bandwidth and very high resolution. And of course, the most stages are very precise. They can do 1 micron steps, but we scan them at 2 microns in both directions. You may also have seen this slide a few times today. But the take-home message here is that this transducer, which is a key part of the system, is a very specialized piece of equipment. This particular transducer oscillates at 250 megahertz. It's based on sputtering zinc oxide on the substrate, and it's using a sapphire lens for focusing, which actually creates a fairly large insertion loss. But again, for the acoustic microscopy application, it is not a big problem. And it's very broadband. And as Daniel mentioned, it's very useful for signal processing. And it's very focused with an F number a little bit below 1.2, and that creates a 72 micron depth of field, and the lateral beam width is 7 micron, which is ultimately the resolution of the final images. And you can go and buy one downstairs, or maybe the same floor, actually. You can just walk out now and go buy one. The signal processing, I have a shortened version of what Daniel presented, but this is the same idea. You're getting a reference signal that has a certain time of flight, which would be seen here, and then you're going to acquire from the sample, and we're basically saying there's two signals coming from the sample. They look like this, and the modeling is that they both some kind of modified version of the reference signal from the glass plate, and with proper fitting, using techniques that Daniel described, we basically can get the sample thickness and then the speed of sound, and then from there we can get the acoustic impedance, the attenuation, and the bulk modulus, or even the mass density as derived parameters. But the impedance mode, I thought I was going to be the first one to talk about this, but again, the previous speaker explained that quite nicely. We're doing it at much higher frequency, but the principle is the same. We can actually not use that substrate. We're using an OptiCell plastic, which allows the wave to propagate. But the principle is the same. We have a tissue that's fresh. Here is a fresh lymph node on the membrane. And basically, we know the impedance of the reference, and we know the amplitude of the signal that we acquire from the target. And from there, we can get the acoustic impedance of the lymph node itself in a fresh state using that different setup. So that's a way to get acoustic impedance value from fresh tissue as opposed to fixed tissue. Okay, so this is where this is going. So we want to do derived form factor from 2D impedance maps. And I've shown a long time ago that you can do it okay with 3D impedance map. And again, Egu also showed that the 2D assumption might be a little bit difficult and not so correct. But assuming that you have isotropic scatterers, really you should have the information you need in 2D. So we're getting these 2D impedance maps from different tissues. And the assumption here is that they contain the same scatterers. So they have the same form factor, but yet they could have a different acoustic concentration, and they could have different scatter size that could change with each 2D impedance map. And under this assumption, when you take the Fourier transform, a little bit like Ego described using that radial symmetry, what you get is something that's proportional to the volume of the scatterers, the acoustic concentration in that form factor that is a function of K and the scatter size, or in that case, the scatter radius within that 2D impedance map. So if you look at this expression, you get one of these for each of the 2D impedance map. So the idea is we want to match them to actually get that form factor function. So there's something about the magnitude that we can fix easily, but there's something about the frequency axis stretching that's a little bit more tricky. But the way we do that is using an optimization technique, and basically we make all these functions, we match their amplitude and stretch their axis so that they match in the best possible way. And we just average this modified spectrum, and that's the form factor. And because it's noisy, and also because we need to be able to evaluate that function at every frequency, we feed it to an exponential model that looks like that. And so essentially the algorithm will spit out alpha and n, and we chose this shape because it's a very well-behaved and smooth form factor, but also because choosing appropriate value of alpha and n, you could actually find back the Gaussian form factor that we've been using in the 26 megahertz study. So what the image looks like, you've seen quite a few of these images. These are actually fixed lymph node. You have the impedance, the attenuation, the speed of sound. So I think this is one example where you can see that for example, the speed of sound in the capsule is higher than that in the center of the lymph node. We can estimate a wide range of properties. And so we really can derive the properties of the lymph node at this higher resolution. And we, of course, have the co-registered histology to compare to if we want and need to identify tissue. And again, these images have about 7 micron resolution. And we're also interested, of course, at looking at what happens in this parameter map when the tissue has metastases. And this is just one of these examples where the pathology is outlining the cancer, and you can actually see some changes in acoustic impedance, which again, just from basic principle, would tell you that the scattering from this region of the lymph node would be very different from the scattering from this region, which is something we could sense with the quantitative ultrasound techniques. And now back to the form factor estimation. We use I use 4 distinct 2D impedance map. I use 3 from fixed tissue and 1 from fresh. They had a wide range of sizes, and I actually limited the processing to cancer-free regions. So basically, this would be a form factor that we obtain from healthy tissue. And as you can see, it's significantly different from the Gaussian form factor. And as such, the estimates that you would get using this model would be different from the Gaussian form factor. So we can really measure the acoustic property of lymph node. We can do the speed of sound, the attenuation, the acoustic impedance. We can do the acoustic impedance even of fresh sample using that impedance mode. And I didn't show this data, but we have a few cases where you can show that the values are comparable between fresh and fixed, except for fatty regions. We have about 7 micron resolution, and that's sufficient to look at scattering at 26 megahertz. We did derive a new form factor. I think that it's obvious that we need to process more maps to be sure what we're doing. But again, the rationale is that we could use this form factor to enhance sensitivity and specificity of the QS techniques at 26 megahertz. So basically, we'd be able to better find cancer or characterize cancer in lymph node. And the longer term of this project would be to have some kind of a box sitting on the pathology suite where the pathologist could just put a lymph node and it would tell them, where there are regions that are suspicious for cancer and where would be a good place to cut to be sure not to miss cancer. Of course, that's good for diagnosis, but not so good for the patients. Thank you for your attention.